um, the different influences from each person in that team in order to make a compelling argument for what we want to have happen in order to create that win-win situation. So that's kind of what we're going to look at today. We're going to define the principles of effective treatment, which, hey, good to know. Explore current trends and practices in treatment programs, and those are rapidly changing. Some of the things that we used to do, we don't do anymore, and some of the things that we haven't been doing, we may start doing in the not-so-distant future. So I'm going to interject a little bit of new stuff as it relates to the President's Commission on Opioid Use, or whatever it was called, that report that just came out. We'll identify some common approaches to treatment, the main components of each approach. We're not going to go in depth. We're just going to kind of hit the highlights, like I said, so you can figure out, if you're working with somebody who uses that theoretical framework, how to create a win-win and how to work together harmoniously. And we're going to compare and contrast each approach a little bit in terms of which clients you might use it with and how it might work in different settings, such as mental health, standalone private practice versus community behavioral health, etc., and maybe different ways that you might be able to implement it. So, principles of effective treatment. Addiction and mental health issues are complex but treatable conditions that affect the brain, the body, and behavior. So this is one of the new changes, and we'll talk about that later, but we're really focusing on the whole person now. We recognize that it's not just the way somebody thinks, it's not just their neurotransmitters, it is a whole brain body behavior thing, and any change in any one of these areas can affect the other areas. So if you start making better behavioral choices, then potentially, like we talked about yesterday with people with alcohol-related brain damage, if they make better behavioral choices, chances are their brain health is going to improve and their body health will improve, and their mood theoretically will improve too. No single treatment is going to be appropriate for everyone. So when people come into our clinic or facility, or whatever you call the place that you work, we can't necessarily assume that group 12-step treatment or individual humanistic counseling is going to work for them. We need to look and say, what does this person need? Now, individual humanistic may work in terms of addressing the cognitions and the mental health stuff, but they also may need some brain body stuff with either a psychiatrist or a physician, and maybe some social skills or something else. So we need to look at the comprehensive picture. Treatment needs to be available to be effective, and you're thinking, well, duh. But in the big scheme of things, when we look at how many people actually are able to access treatment, only about 10% of people with addictions are able to access specialized treatment each year. And the number's a little bit higher for mental health, but it's not, wonderful. Less than 50% of people who have treatable mental health conditions receive treatment. So we want to look at why is that. And one of the reasons, soapbox warning, is because treatment is too expensive for a lot of people. They have deductibles that are $1,300 and up. The average deductible for a person, a single person, is $1,300, which means insurance doesn't cover anything until they pay the first $1,300 out of pocket. Now, if a clinician charges $100 a session, that's 13 sessions, which could be virtually the entire course of treatment before insurance even kicks in. And a lot of people don't have that kind of money just kind of laying around. So we want to look at the affordability and availability of treatment, which is one of the reasons I push groups a lot, because groups are a way that we can provide a lot of services for affordable amounts for the clients and still, put food on our own tables. So looking at how can we as clinicians make treatment more available to those in our community. Virtual services, that's something that we can look at. Telemental health, so people don't have to get babysitters, don't have to travel. Group therapy, having services on the weekends or during the evenings. Those are always great. Now you're thinking, well, that's when I want to be with my family. True. So it's always a trade-off. You got to figure out, could you do evenings 2 days a week or something in order to be available? And that's something that is a choice that you've got to make on your own. I know when we were setting up new programs, we would always look at where the demand was. Where did we have the waiting list? Was it the morning programs or was it the evening programs? And what kinds of services were in highest demand? So effective treatment attends to the multiple needs of the individual. So we're not just doing that mental health assessment and going, okay, you've got you meet the criteria for major depressive disorder, so we're going to treat that, and we're going to talk about all the reasons that you're depressed. Well, effective treatment is also going to look at their nutrition, their living environment. Is there stress there? Their work environment, and attending to any medical needs that may need to be addressed to also deal with the depression. Current trends and practices focus on the client competencies and strengths. Instead of saying we're going to get rid of your depression, we're going to say we're going to help you feel better. Yeah, it's the same thing. But instead of getting rid of something, we're adding something. We're putting something awesome in its place. And one of the principles of behavior modification is that you don't want to just punish a behavior. You don't want to just get rid of things, because if you get rid of it, you have to have something to put in its place. So too often, parents and caregivers and clinicians even sometimes will get in the habit of taking away things, or let's take people. They make New Year's resolutions. I'm going to stop smoking. I am going to stop eating sugar. I am going to stop doing this and stop doing that. Well, that's just grand, but all those things serve a purpose. So what are you going to do instead? And that's one thing that we want to ask. What are we working towards? What's our goal? And what strengths does the person have? Maybe their social skills are weak. Okay, maybe they've got a lot of social anxiety that contributes to their other mood issues. Okay, well, we'll deal with that, but let's look at what strengths they have. Maybe they're really articulate. Maybe they're really smart. Maybe they are introverts, and they just don't really realize that people who are introverted tend to get more stressed out in large groups. So we can help educate them about their strengths as an individual. So we want to focus on strengths and build clients up. We want to focus on what's worked in the past. Instead of saying, okay, you're in my treatment program, let's start at